Good afternoon. I'm George Latimer, Westchester County Executive, and welcome to our Westchester Weekly Update. It is Monday, July 18th, and this is our opportunity to report to you, as we do once a week on Facebook Live, some of the key issues that are facing us here in Westchester County. I'm going to be joined in a few minutes by the mayor of the village of Buchanan, Theresa Nicabacher, who was with us previously, and she's back again to talk a little bit about what's happening in that municipality, which is in the northwest corner of Westchester County. It is the smallest incorporated government in Westchester, around 2,300 people, and we're very happy to have her here to talk a little bit about that community. We also have with us in a few minutes the commissioner of our probations department, Rocco Posey, who's going to talk a little bit about our programs for pretrial, probation, and parole, all of which is part of our crime-fighting efforts in Westchester County. We always think in terms of the police as a major element in fighting crime, but our corrections department and our probations department are also part of that law enforcement trio that helps us deal with those who have already been incarcerated and are now back into the community to try to reduce the likelihood that they will go back to committing crimes and thereby reduce the overall crime situation in Westchester County. After Mayor Nicabacher speaks, she'll be up. We'll give you an initial update on Monkey Pox, which seems to be the talk of the day. We'll have Mayor Nicabacher. Then we'll give you a quick update on COVID. Then we'll discuss what's happening in the world of probation. We will then have Ken Jenkins, our Deputy County Executive, join us to give you the update on the weekend report on our park system. We have a very big park system, very busy over the summer weekends, and we've had good weather almost completely over the last month or so, so we've had full attendance, high attendance in each of those different areas. We'll remind you again of the things we're doing to try to deal with the inflation spike that we're experiencing in the country. There's a new suicide prevention number. Ken, again, will help give you an update on that, and I'll talk a little bit about our 9/11 first responders efforts. We're still just about a couple of months away from the next 9/11 commemoration, but we're making some efforts to recognize those that we've lost through 9/11 related illnesses. We established that wall of remembrance a year ago, and we want to continue it going forward. Let me begin briefly with an update on Monkey Pox. This is the discussion of the day. It's been covered in press. We began our clinics today giving out vaccinations for those that either have been or are in fear of having been exposed to monkeypox. Monkeypox is a viral infection, but it is not communicated in the way that COVID is. And it's inevitable, as I said last week when we discussed this in detail, that people make the comparisons. We haven't really talked about epidemics or pandemics to any great extent until COVID came along the last 2.5 years, and now we view everything through the prism of what COVID is. Monkeypox is not COVID. It is not as communicable because it passes from one person to another through skin-to-skin contact, and generally in intimate settings. So the likelihood of a person receiving COVID is much greater because it's an airborne virus. It's something that you can pick up without having to not just touch somebody, but even be in the same room with them. If they were in the room and for whatever reason they sneezed or coughed and they put a certain amount of the viral content in the air, you potentially could get COVID. And that is why we have the number of cases we have at COVID that are much higher. The most recent number, we'll talk about this in a second, 3,600 active cases of COVID. Right now in Westchester County, we have 18 cases of monkeypox, and that are cases that have been detected and are being treated. Monkeypox is not primarily a fatal disease. It can be fatal in certain circumstances, but it generally is not fatal. And of those individuals who have been identified as having monkeypox for some period of time, there is none of them that are in jeopardy of losing their life. They're all on the mend, so to speak, and we expect to have full recovery by all 18 of the individuals that we have right now. Now, I mentioned that we've begun our vaccination program. Other jurisdictions around us have vaccination programs as well. We began it today at our White Plains Clinic at 134 Court Street, right here in downtown White Plains. And today we have administered, or will be administering by the end of the day, 108 vaccinations for monkeypox here in Westchester County. And we're continuing to open on Mondays and Wednesdays the clinic here in White Plains for that purpose. It is 12 to 3 on Mondays and 4 to 7 on Wednesdays at this location. So while we have all of the appointments scheduled and booked for today through 3 o'clock, which is within the hour, we have not fully booked up on Wednesday, and so we're expanding the Wednesday clinic until 7:40, so another extra 40 minutes attached to the end of the day on Wednesday, and there are appointments available for Wednesday. If you are interested, call 995-8900, 995-8900. That is the special number that has been set aside by the health department to deal with monkeypox inquiries. Now, when I reported on Friday, I gave you the general number for the health department, and they have now created a number specific for monkeypox purposes, so you don't have to call the general number, which I gave out last week. You can call this specific number, 995-8900, and that will give you information as necessary. We have worked with our LGBTQ advisory board, which is one of the boards and commissions in county government, to help us prioritize some of the most vulnerable groups and get the message out, both on how to detect monkeypox and then how to deal with getting vaccinations as is necessary. Now, as I mentioned last week, I'll mention it again, testing is a different technique and a different tool than it is in the world of COVID. You can get COVID and not necessarily evidence any symptoms of COVID. On monkeypox, you don't know that you have it until you exhibit a symptom and then test to determine if that symptom means that you have monkeypox. Most notable by a rash or a lesion on a person's body. Sometimes the palm of the hands, the bottom of the foot, and in some other areas. And in those areas, the testing is to take a swab of the area and then have it tested in a lab to determine if you have monkeypox. The good news is that the vaccinations, and there are some different types of vaccinations depending on whether you think you have it or you absolutely have it, but regardless of that, the medical professional knows which fall into which categories. If you're vaccinated with a positive case of monkeypox, the vaccination can help clear up the infection of monkeypox. So it's not just a question of you having to isolate yourself and wait out a certain amount of time. The vaccination can help you cure you of monkeypox over time. But every case is individual, and we always encourage you to have discussions with your medical professional. If you don't have a medical professional, then one of the major hospitals or the medical groups that exist out there, the local neighborhood health centers that exist out there, that is a great place to start your inquiries rather than just doing it on your own or consulting the internet and making your best guess. But we are trying to target the vaccinations because we do not have an unlimited supply of them. I think we've seen in New York City how quickly the supply has been used up by the New York City market. And of course, the number of cases in New York City far exceed what we have. We have 18 known cases. New York City is up over 400 cases of monkeypox as we currently speak. Nationwide, the last number I saw was in the vicinity of 1,500 cases. That number may have been increased over the last day or so. But it is nowhere near as widespread. We're talking nationwide, 1,500 cases of monkeypox. In Westchester, 18, and I just gave you the metric of about 3,600 cases of COVID in Westchester alone. So there's a big difference between the two. But we are appreciative of the fact that people are trying to understand what the disease is and trying to respond appropriately to what that disease is. So if you have contact that meets the criteria and you're issued a vaccination, that hopefully will help you. We want to make sure that each person who thinks they may have exposed other people to this, it's very important for contact tracing to make sure that those people are reached so they can be contacted and they too can get a chance to get the vaccination, which we think is appropriate. We have received an aggregate of almost 800 doses of monkeypox vaccination. That's part of what's being given out at our health centers and some that have previously been given out at major medical facilities. We've mentioned White Plains Hospital's gotten a certain number of doses. The Westchester Medical Center in Valhalla has. St. John's Riverside and Yonkers has. Also, our federally qualified health centers have been given out an amount of doses. So all of that comes into play. Once again, there are certain vulnerable communities within certain social circles, and we want you to be alert to this to try to reduce the potential for skin-to-skin contact and therefore advancing the monkeypox vaccination. And of course, we're in direct dialogue with the New York State Department of Health. They are our partner in these things, along with the federal government. They provide to us the monkeypox vaccination for our distribution to those who need it. And we are working with New York State to try to access additional doses based on the demand that we see here in Westchester County. But I want to give you a confidence level that we're working on this. We're working on it very, very rationally. We have medical professionals who are involved in it. I'm not a medical professional. I'm merely reporting to you that which our medical professionals are trying to implement to give you a sense that, yes, monkeypox is serious. We take it seriously, but this is not a reason to be concerned beyond the parameters of reality. We hope that our vaccination plan will be sufficient, and if it isn't, then we'll move it to the next step. But for right now, we feel as if we're responding to the monkeypox outbreak in a responsible way, and we hope you do. We hope you'll interact with us. Once again, 995-8900 for monkeypox information through our health department. Now, I'd like to bring up the mayor of the village of Buchanan. We have worked together on some projects. Buchanan may be a small community, but it's a very impacted community. It was the home for the Indian Point nuclear power plant during its years of operation. There are still issues now as the plant is decommissioned. Buchanan sits on the very beautiful Hudson River at a very strategic portion of the river from environmental purposes, and the people who live in Buchanan always have the first St. Patrick's Day parade of the year, and even in the COVID year we managed to get that parade in before the other ones had to be canceled. So I'm very happy to have Mayor Theresa Nicabacher with us. Madam Mayor, thank you for being with us. Please tell us a little bit more about the village of Buchanan.
Oh, great, yes, absolutely. Thanks, George. Thank you for the invitation, and I'm very happy to be here today. The village of Buchanan is a very beautiful community in northern Westchester. It still has a small town USA feel. We have a wonderful mix of people there. We have seniors that live there. Some were born in the homes, their family homes. And for example, I know my mom was born in the family home, still lives in the village, and also my Uncle George. And then what we're seeing is a trend of newer, younger families coming in. A lot of them are coming in from Westchester County. So the village is a nice place to live for seniors. It's safe, and it's also safe, for the children, raising children, young families. And as you know, the village of Buchanan was the host community of 3 nuclear power plants over 60 years. In 1962, the first nuclear power plant. So we were one of the first commercial nuclear power plants within the country. Unit 1 went online. Con Edison put that online. And over 60 years, we, like I said, had 3 nuclear power plants. Unit 3 ceased operations April of 2021. So as you can imagine, the challenges that the village faced after losing its largest taxpayer, its largest employer, it's a good corporate neighbor, and also an energy source that has 0 carbon emissions. But let me mostly speak about the loss of the revenue. We lost approximately half of our revenue. So that in itself is thinking out of the box and trying to how to get through that. So the other thing, too, is, like I said, loss of a good corporate neighbor. So Entergy was good not only to the village of Buchanan, but throughout Westchester County, supported a lot of volunteer organizations. One of them that I'm associated with is the Peekskill Rotary. They also Guiding Eyes for the Blind. So they were very generous. So not only did we lose the revenue, but we lost a good neighbor. But we went into survival mode, and I think how you have to think of it, you can't think negatively, you have to think so with your greatest challenges also comes great opportunities. So one of the things I think I'm most proud of, and it was a collaboration with other governmental units. I was involved for many years with organizations throughout the country who were faced similar issues of having nuclear power plants and spent fuel on site. We have been working, and you know how difficult it is to work with the federal government, so we've been working on trying to get the Stranded Act passed, and that is for communities that have spent nuclear waste on site, trying to get some monies for that to compensate for the storage. So as I was thinking, and I said, you know what, we don't have anything like that in New York. We cannot task these spent fuel casks. These spent fuel casks are worth $1.3 million. We're going to have approximately 125 of them. So in my mind, I thought, well, there's 125 $1.3 million houses. That spent fuel will not move off of the property for many, many years. There has to be a place, a storage, the Department of Energy has been working on this for years to have a permanent repository. That hasn't happened. I don't think that's happening anytime soon. So we worked very closely with Senator Harcum and also Assemblywoman Galiff, and we got legislation passed. And miracles of miracles, Governor Cuomo did sign it into legislation. So it helps us, it gives us a basis for that property, because how do you tax a decommissioned, a power plant that's being decommissioned? It's very difficult to do. So that helped the community a lot. Also, right now, we are working on replacing our tax base. We lost approximately $3 million. So we're currently rezoning the Indian Point property, because the Indian Point property, how it's zoned, part of it is for the peaceful use of nuclear energy. So we're not going to see that again. So we are looking at redeveloping it as a mixed use. And you see that all along the Hudson River. People are going away from the industrial. It's all about mixed use development. Entergy, when Entergy sold to Holtec, we became on the intervenor status. So we were able to negotiate that Holtec would have to negotiate with us a release of property. The 60 northern acres is what we're looking and working on. If that happens, then we'll be able to develop that. The earliest that can be released is in 2024, so we continue to work on that. We've been fortunate to have some developers approach the Village of Buchanan. At one of the last meetings, we have a developer who's looking to do a 5-story residential property behind our hardware store, approximately 150 units. So that's in the process. And we also have another developer that's looking to also build a 5-story residential building. So we do have interest for people to come in to develop. Also, we had gotten approval to have, there was money etched out of the Entergy closure agreement. So when Entergy left, they made an agreement with the state of $15 million. And that was to be used for environmental and community items. So the Village of Buchanan fit right into that, because we need to upgrade our sewer treatment plant. So we aggressively pursued that. $7 million was etched out for that. We have been working with the town of Cortland on trying to do an IMA agreement, which would allow the town of Cortland to come in and into our sewer treatment plant, use our sewer treatment plant. So it would help the town of Cortland, because they can also develop, and it will help us because we have to upgrade our plant. So hopefully, we're working still on the agreement, so hopefully that will go forward. And the important thing is to remember, this $7 million is Entergy money. So this is not taxpayer dollars. So the upgrade would be done through a grant through the Entergy money. So as you can see, we've been very, very busy. We're working on replacing our tax base, and it's a process, but we're moving forward. And we have other things in the works that I'm not ready to discuss yet, but it's been, since the announcement in January of 2017, it's been a very busy time for the village, and we're continuing to move things forward. So I want to thank you, County Exec, for inviting me today. I really appreciate that. And not only Sandy Galiff and Peter Harcum, but George has been a very good friend to the Village of Buchanan. He has worked very closely with the village. What do you need? Do you need help? Whatever you need. So George, we really appreciate that, because it was a scary time for us. It still is a scary time, but we very much appreciate your support.
Thank you very much.
Thank you. All right, take care.
Appreciate you. That's Mayor Theresa Nicabacher of the Village of Buchanan, who's with us here, and I think what we've tried to do is be a good partner to all 45 municipalities in Westchester County. There are 20 villages, 19 towns, 6 cities, all of various sizes. And Yonkers, as a city, third largest in the state, is an incorporated municipality, over 200,000 people. And Buchanan, at 2,300 people, is also an incorporated municipality. And every municipality has their priorities. They have their tax base. They have to deliver basic police services, fire, sanitation, snow removal. And each one has their own challenges that are unique, and we want the county as a regional local government to be a good partner to our local government. So again, thank you for being with us today. We appreciate it. I'm going to give you a quick update on COVID. And of course, we've been tracking this now for almost 2.5 years, and the numbers continue to oscillate. We have, as of yesterday, Sunday the 17th, the information that we received from the state of New York shows that in Westchester County, we have 3,613 active cases of coronavirus. These are people who have tested positive sometime over the last 10 days, have not gone through the protocol yet, in which the disease has lifted for them. That number is slightly down from where it was on Saturday and Friday, slightly above that number. It is ahead of where we were a week ago and 2 weeks ago by a couple of hundred cases. A week ago, what was 3,600 this time was 3,356 a week ago, and 2 weeks ago, 3,175. But that's a very slow increase. That's not an exponential increase. It looks nothing like the Omicron surge, which at one point put us up to 36,000 cases. And some folks have said, well, COVID is on the rise. It is. It has not risen near that level at which we had when we looked at mask requirements inside county office buildings or in other settings. And so while the number of cases are rising, it's rising in a relatively small percentage to what we saw the last time around. We do think that for those people, certainly those that are vulnerable, those that have existing health conditions, mask wearing, and they get advice from their doctors, but mask wearing is a good thing to try to reduce the likelihood that they'll get the disease. And the more important task is vaccinations. Now we're at a point where most people who've been vaccinated have been vaccinated 3 or 4 times, depending on where they are in their situation. And people have gotten the disease now 1 and 2 and 3 times. And almost a universal reality that everybody's gotten COVID at some point in time during these 2.5 years. But while our fatality numbers are not rising proportionate to what they were, there are still fatalities, every week. In the last week, from when we tracked these numbers, we lost 5 individuals, and the week prior to that, we lost 3 individuals. So that rough situation gives you an idea that there is some loss of life each week, and that, of course, is always a tragedy. From the hospitalization side, we were fairly static over the last week. We had 157 people hospitalized the last time we tracked. The week before that, it was at 152. There was a jump up from the week prior to that, where we were at 121 cases. But the variant of how sick people get, if it's in a range of 125 to 150, if it goes down to 100, even if it goes up to below 200, that's still a very low range of hospitalizations. You may recall in the heart of the pandemic, the magic number was 2,700, because that's the number of hospital beds that exist in Westchester County if you cleared all the hospital beds of other uses. And when we saw the beginning of the pandemic and it was running wild in Wuhan, China, and Lombardy, Italy, the hospital systems could not handle the demand of cases. And of course, now we're handling that demand of cases at a reasonable level. We're also outdoors during the month of July, and so that may be a factor in terms of seeing some increase because of the likelihood of spread, but not a dramatic increase. And we'll have to wait and see what the fall season brings us when we start getting closer together and more indoors in about 60 days, 90 days. But for right now, the status of COVID falls into the categories that I've just referenced. Now, we're providing free COVID-19 vaccinations for children ages 6 months to 5 years of age all throughout the summer. We're offering free pediatric Moderna COVID-19 vaccines by appointment to children, and that is done at the same county clinic that we just referenced in White Plains, 134 Court Street, and that's been provided on Fridays during the summer from 9 a.m. to 12 noon. And that is an opportunity for people to go with their children. It's now been approved through the FDA, 6 months to 5 years of age. Those children can be vaccinated. And pediatric vaccinations are available at the county health clinic on Fridays. We mentioned Monkey Pox on Monday and Wednesday. Friday is a different day of the week, and Friday is when we do that vaccinations from 9 to 12 by appointment. And again, you want to call the county health clinic to get information that would help you. You can also go online. We may be showing the website health.westchestergov.com/2019-novel-coronavirus to give you more vaccine information. Now, from 9 to 12, pediatric vaccinations for those under the age of 5. From 1 to 3, we open up vaccinations on Friday only for all individuals of any age that seek another dose of vaccination. And depending on where you are in the process, if you're getting your first shot or your second shot or your third shot, aka your first booster, if you're ready for your 4th shot, whatever it is, 1 to 3 o'clock on Fridays at our health clinic in that location. So I think that gives us a sense that we're working on the medical issues that are at hand. COVID is with us. It's rising slightly, but we're trying to be mindful of it, and we're trying to have as much of a normal summer as we can. In a few minutes, Ken Jenkins is going to report on our parks, and clearly many people are desirous of being outdoors and enjoying recreation, and we believe we're doing that safely, given the fact that the numbers I've reported show no spikes, even though we've had the Asian American Heritage Festival, we've had the African American Heritage Festival, the Hispanic Festival, and we've also had our beaches open now on weekends since Memorial Day, well over a month ago, and our pools now have been open around the clock with very high attendance levels, which Ken is going to report on. Let me highlight next how proud we are of our probation department, and Commissioner Rocco Posey is here with us to recognize pretrial probation and parole week. Pretrial probation and parole week. And as you can imagine, just by that, pretrial comes at the front end of an individual that may be dealing with incarceration. If they are incarcerated and they complete their term of incarceration as authorized by the court, they then go on probation and then parole that follows that. And we have a very fine department of probation that is responsible for these situations. They have a national week recognizing pretrial probation and parole. Now, the acronym is PPP. We don't want to confuse you with the federal PPP program, which is a completely different program. And sometimes, just as a person who comes out of a sales and marketing background, I flinch when government agencies always go to an acronym as if those are universally discussed amongst us in the society. But for this particular program, we are now in the middle of the week that recognizes pretrial probation and parole from the 17th through the 23rd. This week originated a little over 20 years ago, and it's a way to sort of pay tribute to those professionals in each community, Westchester amongst many, and really to recognize that this is an essential part of the overall justice system. And as we look at, as I said a second ago, all of the things you do to fight crime. You fight crime with police who are out in the street to deal with apprehending those that are accused of crimes, to stop criminal activity when they see it. We know from watching Law and Order for the last 20-some-odd years on television, there are two different branches, and they talk about the prosecutorial branch to deal with that, and there's a judicial branch that sits in judgment on the prosecutions and the defense of those individuals. And then you have the correction component that follows, and then beyond that, the probation component that follows. Although pretrial services fits in a niche before correction begins, before the trial actually begins for the individual. So it's a bit of a complicated process. If you haven't interacted with it yourself or your family members, we're happy to know that. We would hope to give Rocco and his department no work whatsoever in Westchester County, no criminal behavior, no need for arrests, no need for incarcerations, no need for probations. But that's not the way the world works. No matter how hardworking any community is, there will be people that break the law, are convicted of breaking the law, and must go through a certain process. We have 144 probation officers in Westchester County. They have done their job through the COVID period of time, and they've done it well. And I think our recidivism rates, which show a reduced amount of people who have gotten through the criminal justice system and go back to repeat crimes, is much lower than those in our comparable jurisdictions when you look at what's happening in New York City right next to us, which is very much a focus of attention. If the mission is to keep our communities safe, our probation department shows a proactive way of doing that. And they work closely with the Department of Public Safety in order to be able to do that. So what I'd like to do is show a video on pretrial probation and parole. And when we come out of the video, I will have Commissioner Rocco Posey here to present him with a proclamation to recognize this exceptional week. But first, we have a video for your viewing opportunity.
PPP Week is a recognition of the work that is done by pretrial services, done by probation departments, and done by parole departments. There's no downtime for probation. Probation officers every day are in harm's way, going out into the community, doing field visits, going to treatment programs, to check up, to make sure that probationers are doing what they're supposed to be doing. Everyone identifies probation as being a criminal justice agency, but we are also a family court agency.
I love the work that I do because I feel like we're turning victims of domestic violence into survivors of domestic violence. It's about empowerment. It takes a special kind of person to work in family court and work with victims of domestic violence. You have to have empathy, you have to have compassion, and We are sometimes the first people that someone sees to stop the violence. By taking that first step and coming into us, they're on their way to recovery.
I could be in the office meeting with people, interviewing the guys that are on probation, and the next day I'm in the field and we're visiting the probationers at their homes, at their places of work, wherever they may be, we can go to ensure that they're complying with their conditions of probation. There's other days where I'm in court. We do searches of the probationer's home. We do searches of the probationer's vehicles. We can search the probationer's cell phones or computers, any electronic device that they have. There is a technology searching dog that we use with the Westchester County Police, and she was trained to sniff out electronics if they're trying to hide something. There's drug testing that we do. There are a few different types of polygraphs. Anyone who is on probation, the officer is in their lives.
The services unit was established in 2017, and we provide essential services: employment, vocation, and educational services for our probationers. We also provide victim services, basically a voice for the victims of crimes. We have a strong relationship with community providers and stakeholders, and we rely on them to keep our probationers from reoffending.
The mission is to keep the community safe. That gives me satisfaction.
Deal with the issues that got them on probation, then we can really protect the community, by not having these events happen again.
So we're here with Commissioner Rocco Posey of the Probation Department, a 33-year veteran of service for Westchester County. And Rocco has served in a number of capacities, but primarily probation over the course of his years. He's done an outstanding job. And Rocco, on behalf of a grateful county management, we want to thank you and your department. And this proclamation summarizes what National Pretrial Probation and Parole Supervision Week represents. And I hope when you bring it back to your team, you'll express to them the thanks and the appreciation, not just to the senior management, but to the people of Westchester County. Even if the average person doesn't know what goes on in the probations department, we all benefit from what goes on in the probations department. So please share a few thoughts if you would.
Thank you very much, County Executive Latimer. And I want to take this opportunity to thank you for all the support that you give to the probation department. I want to thank your great staff, which includes Ken Jenkins, who's in the room with us, Joe McDonald, your chief of operations, and I also want to thank Catherine Chiaffi and her staff for the video that you had the opportunity to see, which really tells a little bit of the story about probation. We do provide some valuable services to the county of Westchester and to the courts, who's our primary consumer of our business. All the supervision of probationers that are placed in our care, and also all the investigations that we do for the court. But we couldn't do that without the great staff that we have at the probation department. I accept this resolution and this recognition on their behalf. Every day they toil in the communities trying to add another level of protection to our communities, but more importantly, as we would like to say, we try to reduce recidivism. We try to stop people, from coming through the system. And as the county executive said earlier, our goal is really to put ourselves out of business. We wish that this was one government service that people didn't have to take advantage of. But if they are and they have issues when they come through our doors, our goal is to help them, and also protect our communities at the same time. So with that being said, I'm going to turn it back over to the county executive. And again, I can't begin to thank everybody in the county for all the support that we get from the county executive's office. Thank you very much. Thank you,
Appreciate it very much.
Thank you.
Thank you. That's Rocco Posey, Commissioner of our Probation Department. Outstanding leadership in the department. Rocco, thank all of your executive team for your fine work as recognized with this. Next, our Deputy County Executive, Ken Jenkins, will give you the rundown for the weekend. During the summer, the county's Parks, Recreation, and Conservation Department really gets a workout with all of the different facilities. We have 55 of them around the county, and many of them reach their maximum usage over this period of time. So Ken, give us the update of where we're at.
Gotcha. Thanks, George. and certainly the outstanding work from our Parks, Recreation, and Conservation Division, led by Commissioner Kathy O'Connor, as County Executives pointed out, it is just their time of year. They shine throughout the year on various things, but whether the golf courses, any of our parks, and specifically the beaches and pools, it is just an outstanding, great job done by all of them. So this week we're going to get another heat wave. That's 3 days of more of 90 degrees or more, and it looks like we may get 5 of those during this week. So we're expecting those high heat this week. So because of the county executive's initiatives, especially on those inflation-fighting measures, Monday through Thursdays are 4 pools and a beach is open at Glen Island Monday through Thursday with no charge to Westchester residents or with a Westchester County Park Pass. If there's parking that you have to pay for in some of the parks you do, you still have to do that payment, but the park itself, the pool and the beaches are free. And because of that, combined with the high heat, we've had record attendance at each one of the pools in Westchester County. So whether it's Chibbits, the numbers are just dynamic over the roof. It's almost 38,000 people year to date that have been at Tibbetts Brooks Pool. Last year is about 20,000. So we're going about 18,000, almost doubling the amount of people that went between this time of year at Tibbetts Brooks Pool, which is an outstanding lazy river, great experience to go there with a dynamic slide that we put in 2018, County Executive, the very first year that in his administration that we made sure to do that. Saxon Woods Pool, so far this year, almost 36,000. Again, 18,000 year to date in 2021, doubling that number. And in the Sprain Pool, the Sprain Ridge Pool, 26,240 people have actually gone through this year in 2022, almost 9,000 over the last week. So again, the parks do have a limit, and now when they reach the beaches or pools reach their capacity, they will not let anyone else in the park. That's something new and that's different because of the just dynamic and the amount of people that are going through. So if you want to make sure that you get that spot, make sure you get there early. Stay, as long as you want. We don't have sessions as we did in the past, and when that capacity is reached, that's all that we can do. They will not let anyone else in the park, and they will definitely not let you into the pool facility if you were walking and taking advantage of the free bus transportation that we have in Westchester County. So get there early, because if it gets hot, everyone wants to get there, and make sure to be patient and listen to all of the folks that are around to make sure that you have the outstanding experience that the Parks, Recreation, and Conservation groups are trying to do. Thanks, George.
Thanks, Ken, and we'll have Ken back up in a second to continue when we talk a little bit about the suicide prevention efforts that are underway. I do want to highlight, just to remind everyone, that the county operates 2 beaches in Westchester County, Croton Point Park Beach in Croton on the Hudson, and Glen Island Beach in New Rochelle. Croton Point Park Beach, as was noted, is open only on the weekends. There's some other work going on there. Glen Island is open during the week as well as on the weekends. We have 4 operating pools. The Playland Pool is still under reconstruction. It was a 2-year project. We're getting close to the end of that, but we're not there yet. And Playland Beach, Boardwalk at Playland, and the Playland Amusement Park is no longer managed day-to-day by the county. It is managed by Standard Amusements. You're well aware of that arrangement that's been back over 6-7 years ago. And the decisions down there, Standard is happy to get the input from the public regarding the amusement park and the beach. Want to highlight that we have continuing to work on measures which we think will deal with the inflationary moment that we're in. And again, being a county government, we do not have the ability to legislate across all areas of the society. We cannot regulate certain things that are well beyond our control as a county government. So we try to figure out what are the things we can do that would help individuals. And both Ken and I have been out in the community to try to see how are these ideas working so far. And this is sort of a repeat of things we've said before, but it bears repeating because we're still in the middle of the inflationary moment. We have added $700,000 in county funds, primarily through the ARPA program, to increase what we have budgeted to set aside through Feeding Westchester for the increased cost of food for those various food pantries around the county. Over the last week, I went to the Ridgeway Alliance food pantry distribution on Friday in White Plains. I was also at the Hope Community Center's distribution earlier in the week in New Rochelle, and there are many others that are out there to see what the impact is of having additional money for additional food. And the demand for food in an inflationary time is much greater. And there are people who have limited resources. They still go to the store to buy certain types of goods that are not given out at a food pantry, but they have the food pantry to supplement that. And the more resources that we've done, it helps those people with their budgets as relates to the amount of food for themselves and their families. We have provided for the month of July, half over now, and the month of August, free commuter parking at 2 lots adjacent to commuter train stations that Westchester County operates and owns. Most of the parking lots that are adjacent to the various stations around the county are owned either by Metro North or by the municipality that they're in. There are 2, both happen to be part of the Bronx River Reservation, and both are west of the train tracks on the Harlem Line Division at North White Plains. There is a major parking lot, North White Plains parking lot, owned by the county and the Bronx River Reservation. You generally access it through the Bronx River Parkway. And then south of that, just south of the Westchester County Center, which has part of the parking lot right in front of the county center ripped up. There is another parking lot that is on the other side of the Bronx River Parkway, between the Bronx River Parkway and the train line, and that is used oftentimes by people that are commuting out of the White Plains train station. So both of those parking lots have been made free for commuters. Now, you don't have to live in White Plains or North White Plains to use these parking lots. It is free for anybody. So if you live in the town of Greenburgh and you commute to the city out of either White Plains or North White Plains, you can park in either one of those 2 parking lots free of charge for the balance of July and for all of the month of August. And that, will save you a certain amount of money that you would normally pay. There are other parking areas around those 2 stations that are not run by the county, and they are not free. So you have to know which parking lot you're going to, but we've made those available. We have made it free for you to sit for any civil service examination through the end of the year. Now, civil service examinations are taken by individuals who want to compete for jobs that are offered out there in a competitive environment. There usually is a fee to even take the exam, whether you succeed or not, and the fee is in part given to the county and in part given to the state. We have foregone the portion of it that goes to the county, and the county is actually paying for the portion that is going to the state. So the state is reimbursed for their portion of the fees, but you, the individual that is sitting down to take an examination, do not have to pay anything. This makes it more possible for you to try to get a civil service job if one is posted in an area that you're interested in, and that's a wide berth of different areas. But there's no fee involved in that. Benefit goes through to the end of the year. And then we're looking right now, we're meeting with the Board of Legislators. We've submitted some legislation in which we have to utilize a sales tax advantage given to us by the state of New York. Things that relate to sales tax, we cannot operate on our own authority. The state has to give us authority, and they have given authority to counties to eliminate sales tax on home heating fuels. And that is a range of fuels. That covers heating oil, propane, natural gas, electric, wood, coal. Let's hope you're not using coal. But no offense to the coal industry of West Virginia. I'm sure Senator Manchin is not happy to hear this report. But any of the other home heating fuels that you're using, we are discussing the possibility of lifting the county portion of sales tax, which is roughly half of the sales tax in round numbers, beginning December 1st for a 90-day period that would expire at the end of February. What does that mean in practical terms? Whatever the cost of home heating oil, let's say heat by oil, you pay a certain amount of money per gallon. Let's say you pay $5 a gallon for home heating oil and you get a 200-gallon delivery. Well, that's $1,000 worth of spending, and you're going to pay 8% on top of that, which is about an $80 tax bill. That's going to be cut in half. So instead of paying $1,080, you'll pay $1,040. The $40 savings, you may have to fill the oil tank if it's 100 gallons. You're going to have to do that probably once a month in a decent-sized winter. So you'll be able to save $40 for every one of those situations. It obviously is calibrated differently if it's electric, if it's propane, if whatever the other methods are. But the bottom line is that if this is passed by the Board of Legislators and they're discussing it with the county administration, we are working within a parameter of what is provided to us by state law. We can't create this program from scratch. We opt into something that the state allows us to opt opt into. We have to give the state sufficient notice, and we can only begin it on a date specific. We could have, in theory, begun it sooner in the year, but really we're not worried about heating our homes in September, October, as much as we are in December, January, and February, really the heart of the winter. So we're hopeful that that will happen when that action is fully taken, if it is fully taken, that we think it's going to be another step. These are the things we can do within county government. And of course, we repeat all the time. We cut property taxes 3 straight years in a row. We hope that is helpful at some level to the people that pay taxes. We know that county is not the major part of your tax bill. You probably pay about 2/3 of your taxes to your local school district, and then somewhere the remaining third is the county's portion, the city or town that you live in, and the village you live in. If you live in one, that total combination is about 1/3 of your taxes. But we have been able to reduce it. In some communities, it's been as much as a 5% decrease a year over the course of multiple years. So it is a significant tax decrease where in different communities the assessment rolls have happened. So we're trying to do those things. We'll continue to look at other options. We are considering other things, but at this point, those are things we're doing to fight inflation, and you should know about it. You should know we're reducing crime. We're trying to fight inflation. We're trying to fix, the various things that need to be fixed in the county and capital projects. We're trying to run a good park system, trying to run a good probation system, and all of those different things. There is something new that has just come out in trying to prevent suicides, which we think is an important element. It comes out of the efforts that are being made by our Department on Community Mental Health. And I want Ken to cover that issue as well from the National Suicide Prevention Hotline. Ken.
Thanks, George. And on July 16th, the National Suicide Prevention Hotline moved from a 10-digit number to a national 3-digit number, 988. Through the New York State's planning functions and the efforts of the Westchester County Department of Community Health and its culinary role, it was determined that St. Vincent's Hospital here in Harrison, which already has a crisis line, would expand to include the 988 number. And we just want to make sure everyone recognizes that whatever numbers were existing already, so if there was a 10-digit number and you had that on your refrigerator or anything with a magnet, et cetera, and you knew what that number is, that number still works around the country, wherever those are. But making 988 available nationwide is certainly a helpful thing, so you don't have to know a number in the area so people can get the help that they need. As one of the major community providers and network participants in the Westchester behavioral health system, St. Vincent's is extremely well positioned to handle the calls, address the immediate needs of an individual caller, and connect them with the services and support as needed. The staffing for 988 utilizes a highly trained volunteer staff. St. Vincent's is currently seeking additional staff for the 988 call lines. So volunteers simply need to be over the age of 18 and willing to participate in rigorous training. So those that are interested in volunteering can call the Crisis Prevention Response Team at 914-925-5959. This, again, is another example of the kind of things that happen around the nation to ensure that we can make sure that people get that mental health services as soon as they need it. Again, 988 is that number. Thanks, George.
Now we'll close out our report with the last thing that we wanted to highlight, which is that we are now looking to, sadly, update our 9/11 responders memorial wall. Our county 9/11 committee created a wall of remembrance, which was launched last year on September 11th to recognize the names of those individuals that have suffered fatality because of related illnesses suffered by working on the pile down in the city in the aftermath of 9/11. We want to recognize those families, and we're doing that now. We've actually done some improvement in the etchings of the names so it's more visible. But unfortunately, we recognize that more individuals who have been suffering from 9/11 related illnesses now have passed away, and this is really an awful situation. But it applies to any individuals who are here in Westchester County who were a first responder not only at the World Trade Center Ground Zero in New York, but also at the Pentagon in Northern Virginia, or were involved in Shanksville, Pennsylvania, where the flight crashed into the field in Pennsylvania. All three of those areas were part of the terrorist attacks on 9/11, and we want to recognize any of those individuals that helped with all of those situations. Matt McCauley is a point person for us on this committee. He can be reached at 914-343-5251. And there's an email address for M. McCauley, which will show up hopefully on our scroll, so you can jot it down. If you know of someone that should be remembered on our memorial wall, unfortunately, we built it with capacity for growth because we know that we would lose people over the years, then we would like for you to refer that to us. We'll do whatever appropriate checking is to be concerned. But each year when we have our Rising commemoration, we want to make sure that we recognize those individuals who made that sacrifice. And what they sacrificed was years of living. Most of the time, the people who worked on the pile managed to live 10, 15, 20 years, but they fell short of a normal age expectancy. They died in their 40s or their 50s or their 60s when they should have had a longer life because of what they contracted at the 9/11 first responding moments, both at the time of the collapse and then in the days after that. We will have this year's memorial on September 11th, which is a Sunday this year, Sunday, September 11th, at 3 p.m. at the Rising, which is at the Kensico Dam Plaza in Valhalla. As you enter Kensico Dam Plaza, moving from the south to the north, you see the dam at the northern edge of the plaza. The Rising is to your right, and it's a very dramatic sculpture. If you have not seen it before, it deserves being viewed the next time you have the time. It is a steel structure. The exterior of the structure evokes the exterior steel that upheld the two World Trade Towers that were brought down, but it spikes and slopes and points upward to something a little bit greater than those of us here, and to try to show a deference to those individuals who died that day. And then there's a ring around the base of the statue, which has the names of those Westchester residents, over 100, that died that day in the World Trade Tower collapse based on the terrorist attacks. The memorial wall is around the perimeter of that walkway area and has the names etched in of those individuals that have died through 9/11 illnesses. We think this is appropriate. This is proper. This is showing respect to our first responders. We try to show respect every day to the police, to the firefighters who serve us every day, put themselves on the line, the EMS individuals that serve us well, and now the medical health care professionals who've been on the front lines of COVID. And it is no different when we think about 9/11. The years may pass, but the sacrifice doesn't change. The sacrifice they made was an eternal sacrifice. They gave up years of life forever. They don't get those lives back, and their loved ones don't get them back. So the least we can do is remember them, and that's what we intend to do by recognizing them on the wall. And sad to say, we will add names to the wall as is appropriate. And if you have any names, people that you know that have passed away in the last year, or people that we may have missed in the initial iteration, please reach out to us and we'll make sure that they're there in time for this year's September 11th activity on Sunday, September 11th at 3 o'clock at the Rising at the Kensico Dam Plaza. So we've covered a lot of ground today. Lisa Reyes is with us in the studio. Do we have questions from the press? Yes, we have Carolyn Fortino, our Deputy Director of Communications. Carolyn.
Yes, we have two questions from Crystal Cranmore at Eyewitness News. The first is, the county executive mentioned how cases in Westchester County were in comparison with New York City and the rest of the nation. In the state, Westchester County ranks second. What is your reaction to that and your message to people who may be worried about not getting a chance to get a dose of the vaccine?
Well, so far, we've been able to satisfy with the appointments that we've made the demand as we have it. 108 cases today have been issued vaccinations. As at the time we began this program at 2 o'clock, we did not have a completed cohort on Wednesday, and we have sufficient vaccinations for next Monday and next Wednesday. So I think here in Westchester may be a bit different from what you have in the city. We appear to have, at the moment, sufficient vaccines available to satisfy the demand as we know it to be. We have reached out to the vulnerable communities in those social circles. We had a group conference call with a major LGBTQ organization, the Loft, and some other ancillary groups on Friday to try to alert them to the procedures so that everybody here in Westchester was aware. So I think at this point we seem to be meeting the need as it manifests itself, but we have asked the state of New York for additional allocation of vaccinations to try to address the need. You know, Westchester is an interesting position. We are the third largest county in population outside of New York City. The four boroughs of New York City have more population than we do, and Nassau and Suffolk do as well. We're the next one in line. Once you go north of the city, we're the largest population county. So I'm not surprised when we wind up having, frankly, more cases of anything. We were the first county to get cases of COVID to any great concentration. And the transport between New York City and Westchester County is very frequent. In many ways, we are the shortest commute into the heart of Midtown Manhattan, shorter commute than Nassau, shorter commute than Fairfield County, Connecticut, or Bergen County, New Jersey. So we would expect to see if the disease is transmitted between people with close personal contact. It is not unusual for people who live in Westchester to be in the city and have contact with people in the city, and then, of course, it's the person-to-person contact that spreads it. I would say, though, that when you're talking about 18 cases, and since it is not an airborne transmission, it is a skin-to-skin transmission, I think if we address the need as it arises, I'm not uniquely concerned about us having a larger number than the counties north of us, because the counties north of us have a lot less population. Just to put it into perspective, there's 10 times the number of people in Westchester County as there are in Putnam County. So if Putnam County had 1.8 cases, they would have the equivalent amount of cases to us at 18. I'm not sure if they have any cases, but if they get 1 case or 2 cases, then we're proportionally at the same level. So I'm not particularly worried that Westchester has more cases than some of the other counties north of us and west of us. But we hope that we'll address the issue effectively, and we'll see what happens. It's still fairly early on. We're probably about 2 months since the first signs of monkeypox had manifested itself, and I think what we're doing is the right thing with the vaccination program and the public education program.
Okay, we have one more question from Crystal. The next question is about our healthcare workers. Should they also get priority for the monkeypox vaccine, since the focus right now seems to be on the LGBTQ community? Is there any plans to get healthcare workers on the fast tracks to a vaccine?
I think what we said in general is that individuals should consult their medical professionals. That includes the medical professionals from our health department and also from the other places where vaccines have been given out. So as I've mentioned, a couple of major hospitals, the neighborhood health centers and so forth. Those individuals who work there are involved in protocols where they're being looked at and analyzed to see if they receive perhaps the contact that would allow for the spreading of the disease. I think it's important to understand that the skin-to-skin contact is not really casual contact. It's generally perceived to be intimate contact. So a simple handshake or a pat on the back, and certainly contact that doesn't involve direct skin-to-skin contact, will not convey the disease. So I think it's more than just those who are in the healthcare field and their level of contact. But yes, we're looking for healthcare professionals who have had contact with patients to be able to make sure that they themselves are monitoring their system, and if they do show signs of having the infection, that they too receive the vaccine. And we believe right now we have sufficient supply to handle those healthcare professionals that have had direct contact with any of those 18 cases. I would not be surprised if the number of cases increase over the next week. If we give an update a week from now and we're in the 20s, that wouldn't surprise me. I would be very surprised if we hit 100 cases or 200 cases. I would think that would be exceptionally surprising. So I think right now we're where I expect it to be, and we have a protocol to deal with it. And at this point, I think we're dealing with it effectively.
No more questions.
Any other questions? Okay. Thank you very much. Well, if there are any other members of the press that have questions for us on any of these topics, please give us a call at 995-2900. Ask for our communications department and some combination of our Cracker Jack team. You've been introduced to Carolyn Fortino, Lisa Reyes, Joe Scamato, the rest of our team all work under Catherine Chaffee's leadership, and we're happy to try to connect for you any of the information you need. And certainly, if you want to speak to Mayor Nicabacher or to Commissioner Posey, we can connect our press friends with those individuals. We're scheduled to be back a week from today on Monday, July 25th. We'll give you an update on both of these two diseases, and we'll give you another parks update. We're trying to monitor a host of different issues and give you as straightforward a report as we can, and we look forward to seeing you over the course of the week. We wish you a very happy and a healthy summertime week ahead. There are a lot of wonderful summer concerts in every community. I don't know about tonight with the rain. I hear some thunder in the background, so perhaps tonight may not be a great night to be out enjoying a summer concert, but there are summer concerts in Mamaroneck Town and Pelham and elsewhere, and hopefully you'll enjoy what we hope will be a good, successful Westchester summer. I'm George Latimer, Westchester County Executive. Thank you for watching. Have a good day.